Hello guys, today we are going to talk about the Bell's palsy, which is the disease of 7th cranial nerve. And this is the picture of Bell's palsy. So in this video we're going to talk about the introduction and its etiology and also clinical features, diagnosis and also its treatment. So let's start with the definition. So it refers to the paralysis of facial nerve resulting inability to control facial muscles on the affected side of the face, or also it is the paralysis of muscle of face when seventh cranial nerve is inflamed or compressed. So this is the Bell's palsy. There is the paralysis of facial nerve. As a result, muscles supplying by facial nerve get paralyzed and they cannot be controlled for facial expression, and there is a paralysis of muscles when seventh cranial nerve is inflamed and compressed. And it was given by Charles Bales, so the name is Bell's palsy, and it is one of the type of facial palsy, and it comes under the facial palsy. So this facial palsy, it is a broad term, and Bell's palsy comes under the facial palsy. Well, in Bell's palsy there is a damage to the lower motor neuron. Let's see the etiology of Bell's palsy. So the exact etiology is unknown, so it is idiopathic. However, it could be viral infection. So when viral get infected in the facial nerve, it can lead to Bell's palsy. It also could be vascular damage. So when the blood vessel get damaged, it could lead to the Bell's palsy during local anesthetic procedure or injection. Also, it could be trauma during accident or other traumas. Also, cold exposure may trigger the facial Bell's palsy, and the main reason is damage to the lower motor neuron that results in Bell's palsy. Now let's see the clinical features of Bell's palsy. The first one is it is characterized by unilateral paralysis of all muscle of facial expression, both voluntary and involuntary muscle. So in Bell's palsy, there is the paralysis of all voluntary as well as involuntary muscles, and it occurs in only one side of the face, and it is subacute in origin. That means it neither occur too fast nor occur too slow. So it occur in moderate speed, and also pain is in the initial presentation. So initially we feel pain, but later it fades away, and all part of face is affected. So whatever the facial nerve supplies, all the part of face is affected, and the affected side of face remain expressionless. So even if we want to express our uh, thoughts, we cannot express, and the creases of forehead are lost. So the wrinkles on the forehead are lost and they become smooth. And also the eyes on the affected side cannot be shut. So on the, if so on the affected side, if we try to shut our eyes, we cannot close. As you can see in the picture, the one eye is shut, but on the affected side it's partially opened. It cannot be shut down. So effort to close the eyes will cause the eyeball to roll up one, and also known as Bell's phenomenon. So this is the Bell's phenomenon. So when as muscles get paralyzed and when we try to close the eyes, the eyes on the affected side cannot be closed and the eyeball roll upward, and it is called Bell's phenomenon. So also here you can see the Bell's phenomenon. The eyeball are being rolled upward and they cannot be shut. Also, nasolabial fold is partially obliterated on the affected side. So there is loss of taste and we cannot taste the food properly. Also during mastication, food is accumulated in the cheeks. So we cannot chew properly and the food is accumulated in the cheeks because of paralysis of the muscle of face. Also the lip remain in contact on the paralyzed side and cannot be pursed for whistling. So the lips remain in contact with each other and they cannot be moved, and also we cannot whistle. And when the smile is attempted, the angle of mouth is drawn on the unaffected side, but on the affected side, the lip remain closed and mouth remain in the character of triangular form. So when we try to smile, the lips on the unaffected side are expressed. So as you can see in the picture, the lips in the unaffected side are open, while in the affected side it remain in contact with each other, and this resemble to the triangular shape, so it is called triangular firm lips. So this is the ideal picture of Bell's palsy. Here are all signs and symptoms of Bell's palsy. So the face is asymmetrical, as you can see in the picture. Face is somehow asymmetrical. The affected side of face remain expressionless. So you can see only one side is expressed, while on the other side it remain expressionless. The right is seems normal, while on the left side it remain expressionless. And also the creases of forehead are lost. As you can see here, wrinkles on the forehead, they are present on the normal side, while on the affected side these wrinkles are lost. So these are the creases of forehead. And also the eyes cannot be shut down, and effort to close the eyes will cause eyeball to roll upward, and that's the Bell's phenomenon. As you can see, the eyes on the affected side cannot be closed, and if we try to close it, it causes eyeball to roll upward, and this is the Bell's phenomenon. Also, the nasolabial fold is partially obliterated. So these are the nasolabial fold, this wrinkle-like structure starting from the nose. So on the normal side, it is well developed, while on the affected side, these wrinkles have disappeared. So the creases disappear, and also the lip remain in contact with each other on the paralyzed side. And when a smile is attempted, the mouth become in the form of triangular face. As you can see, the lips become expressed on the affected on the normal side, while on the affected side they remain in close contact, and the mouth is in the form of triangular shape somehow. Now let's check the associated syndrome. The first one is Melkersen-Rosenthal syndrome. So this is the triad of fissured tongue, facial swelling, and 8 cranial nerve paralysis, which is vestibulocochlear nerve. And also crocodile tear syndrome. So in this syndrome there is an injury to the facial nerve. As a result, nerve fiber regenerate on the lacrimal gland, and this results the tear while eating. So patient tears while eating. And also Ramsay-Hunt syndrome. So this is the severe facial paralysis of pharynx and auditory canals due to herpes zoster. Let's see the treatment of the Bell's palsy. So 70 to 80% recover spontaneously without any treatment. And also local heat therapy provides some recovery. Also artificial tears and ointment can be used to protect the eyes. And physiotherapy can also help a lot to recover quickly. And in case of medication, dexamethasone 2 mg for 8 hourly for 5 days is effective. Also prednisolone can be given, that is 40 to 60 mg daily for a week. And heavy dose of vitamin B12, that is 100 unit gram per day. And in extreme cases, surgery is required, so they will decompress the facial nerve. Also nerve anastomosis reanimation can be done.